Thank you very much, Dr. Christine. Hi, everyone. Thank you very much for taking time today to attend this webinar. It's really a pleasure and honor to be here, and I am very grateful to Dental CE Academy and especially Dr. Rowling for this invite. Today, we will be discussing a very important topic in dentistry, understanding the aphthous ulcer from its triggers and how to manage it. In this webinar, I am excited to share some important steps to effectively manage aphthous ulcers in clinical dentistry. My goal here today is to make this webinar very informative and interactive, so I really encourage everyone to participate in the discussion after the end of the seminar so that we can have a meaningful discussion. Okay. I will not repeat my profile. Dr. Kristen Rowling has very well explained about my profile. I just want to add that I am very much focused toward how we can integrate oral health into systemic health and systemic health into oral health that all together makes towards a better human being and a better human health. So we'll discuss this topic in detail. These are the educational course learning objectives for today's seminar. We will understanding the cause and characteristics of aphthous ulcers in dental patients. We will discuss the factors that contribute to delay healing and secondary infection in aphthous ulcers. We will also explain and discuss how specific clinical solution can speed up healing and prevent complications. We will identify simple steps to integrate these cares into our daily clinical practice. And we will also recognize by adapting all these facilities and these new treatment modalities, how we can get the financial benefits by reducing infections and improving the clinical outcome of the patient. Few disclaimers here. So this CE webinar is sponsored by H2 Ocean LLC. I am currently serving as a Chief Scientific Officer for the company. And being a Chief Scientific Officer, I am currently having a financial relationship with the company as well. So let's start the journey of learning about aphthous ulcers. So aphthous ulcers are also known as canker sores and sometimes also referred as recurrent aphthous stomatitis. In a broader sense, it is a painful open sore in the mouth. Aphthous ulcers are white or yellow and surrounded by a bright red color. They are not cancerous. And a canker sore is not same as cold sores. So this is very distinction factors we have to keep in mind. By definition, according to medical dictionary, it can be precisely defined as a break in skin or mucous membrane with loss of surface tissue, disintegration and necrosis of epithelial tissue, and often recognized with having a pus. Till date, there is no solid solution to prevent and manage aphthous ulcers in a clinical settings. And it remains one of the most challenging situations in clinical dentistry even today. Lot of research papers have been published, and even this recent paper published in 2001 has cited this situation as one of the most difficult clinical entity to handle. So we just want to build up how difficult this situation is and how much we are dealing with it right now. Before we go into the all causes, clinical feature, and the management of the aphthous ulcers, I strongly believe it is very much important to understand the fundamentals of the oral mucous membrane, how the oral mucous membrane functions, and why it is important in aphthous ulcers management. So let's delve into the fundamental concepts of mucous membrane to grasp the reasons and mechanism behind the onset of aphthous ulcers. The mucous membrane is a moist mucosal layer that lines cavities within the whole body. I mean, these areas include respiratory tract, digestive tract, reproductive tracts, and so on. This viscous lining is kept permanently moist by cells named as goblet cells that store and secrete mucins. And these mucins form protective layers known as mucous membrane. In general, the mucous membrane holds a great function as a part in the immune system: physical barrier function, chemical defense, immune cells, lubrication, mechanical cleaning through turnover of the cells, and so on. In addition, a large and highly specialized, innate, and adaptive mucous immune system protect these surfaces. In a healthy human adult, this local immune system contributes almost, let's say, 80% of all the immunocytes. And these cells are accumulated in or transit between various mucosa associated lymphoid tissues, or commonly known as MALT, which together form the largest mammalian lymphoid organ system. That is why it is very important to keep the mucosal immunity by micronutrients and by maintaining a microbiome balance. In terms of oral cavity, the oral mucosa, also called as the oral mucous membrane, is the mucous membrane that lines the entire oral cavity. This includes mouth, tongue, inner cheek, nasal passages, and pharynx. The oral mucosa has a number of protective functions. However, the most essential protective function of the oral mucosa is that it acts as a first line of defense against oral pathogens and viruses. Oral mucosal immune system also function as a barrier, or sometimes we can call as a wall, that separates oral bacteria and viruses from underlying soft tissues. And that's why it helps in preventing infection, bacterial pathogenesis, and diseases. So it is very important to understand how these mucous membrane works and why it is very important to maintain the integrity of the mucous membrane. So when we look towards the structural layer of oral mucosa, a mouth ulcer is damaged oral epithelium and its underlying layer, lamina propria. This is the zone of ulceration. So when an aphthous ulcer occurs, these are the two layers of the oral mucosa that mostly get affected and ulcerated. That's why we call it a zone of ulceration. Now let's discuss about the prevalence of aphthous ulcers. 10 to 25% of US population have aphthous ulcer at one or the another point of their lifetime. Females are more frequently affected than males. Aphthous ulcers are more commonly seen in adolescents and young adults. Genetics plays a very significant role in susceptibility of aphthous ulcers, especially if you have a family history of aphthous ulcers. In certain regions, there is a high prevalence of aphthous ulcers because of dietary or environmental factors. In terms of, I can say that in Mediterranean countries and Middle East, you can see more prevalence cases of aphthous ulcer because of high spicy food and other ingredients. Clinical features of aphthous ulcers. First and most important is location. Typically, it is very important to understand these ulcers occur on non-keratinized oral mucosa, including the sides of the lips, cheeks, floor of the mouth, and the soft palate. Now, when we say that non-keratinized, I just want to touch a light over that. Epithelium can be categorized into keratinized and non-keratinized based on the presence of protein called keratin. So, the non-keratinized epithelium lining organs like mouth that lacks the tough layer at is because mucous membrane has to be formed by living cells, allowing the functions like secretion of saliva as well as absorption of nutrients. That's why it is very thin and it has a high turnover rate. That's why it is more susceptible to ulceration as compared to the non-keratinized tissue, which is hard and which is tough and which is usually made by the dead layers of the cell. That's why aphthous ulcers mostly occur in the non-keratinized epithelium layer. When we discuss about the shape and the size, this is a typical picture of an aphthous ulcer. It's a round and oval in shape with a well-defined erythematous halo surrounding a central yellow, white fibrinousous pseudomembrane. So it can be clear-cut defined. You have a halo region with a yellow pus formation in the center and a well-defined red margin. And they may be present in a single or multiple way in the same time, depending upon the situation, clinical situation of that particular time. When we discuss about the pain, pain is one of the most prominent feature of aphthous ulcers. So the patient usually come with this symptom of high intense pain, and especially that pain enhances while eating or speaking. When we look upon in general the healing time of the aphthous ulcer, it usually takes 7 to 8, 10 days to heal. While that's we are talking about the minor aphthous ulcer, but if you look for the major aphthous ulcers, they can take more time. They can take weeks and weeks to heal. And when we discuss about the recurrence, episodes of recurrence usually happens with the intervals of weeks or months. And there is a period where you can say that transmission usually happens. So it's very important to understand when a person gets an aphthous ulcer, there is highly chances of remissions and recurrence of the condition. So that's why it is very important to carefully monitor and guide the patient in the right perspective so that they can avoid these episodes of recurrence in their oral cavity. Now, there are critically very important complications of aphthous ulcer. It is not confined only to the pain and the challenges associated with the oral cavity. No. So the most important challenge is secondary infection. So ulcers may become infected with bacteria such as Streptococcus or Staphylococcus, which are a kind of an opportunistic bacteria present in the oral cavity that can prolong the healing and cause systemic symptoms like fever. That's why it is very important to maintain oral microbiome in a good shape so that opportunistic infections and secondary infections can be prevented in aphthous ulcers healing period. Nutritional deficiency, another complication is that definitely when you have, and especially when you have multiple aphthous ulcers, it impairs the patient from eating and leading to lack of nutrition intake and definitely have a malnutrition status, especially when you have recurrent aphthous stomatitis or when you're dealing with the severe cases of aphthous stomatitis. Another complication is speech and swallowing difficulties. Large or painful ulcers may interfere with speaking or swallowing, and it definitely affects the quality of life. So it is very important to understand these complications. Chronic pain. When you have repeated episodes of aphthous ulcers, there are high chances of a kind of a sustainable mild to moderate chronic oral pain inside the oral cavity that can contribute to stress and anxiety levels. And it's an ongoing chain. When you have stress and anxiety, there will be more episodes of ulcer. With prolonged retention of ulcers in the mouth, delayed healing period of these ulcers, it can increase stress and anxiety. So it is very important to handle the situation in a right perspective. Scar formation. Another important complication of aphthous ulcer is scar formation. Especially the major aphthous ulcers can leave scars upon healing, which may result in permanent changes into oral tissue structure. So it is very important to understand these complications and how best we can manage them. So the key in all these complications of aphthous ulcer is we have to manage them First of all, we try to prevent them. These episodes should not occur. And if those aphthous ulcers occurs, the key to success is fast healing. If the ulcer heals fast, we can avoid all these complications. Now, there are different types of aphthous ulcers. So basically, we can categorize into three types of aphthous ulcers: minor aphthous ulcers, major aphthous ulcers, and herpetic form aphthous ulcers. Now we'll discuss each of them in little detail. This is a very clear, typical picture, clinical feature of an aphthous ulcer, minor aphthous ulcer. And it's a beautiful picture where you can help to understand the real clinical situation. These are very common, minor aphthous ulcers, in terms of clinical settings when you observe in your patients. These occurs are very small, usually 2 to 5 millimeter in dimensions. The healing period usually 7 to 10 days. So, and we will discuss down this presentation how we can enhance this healing period and make the healing process more fast so that patient can be relieved at much easier level and much earlier level. Minor aphthous ulcers does not leave scars. They are painful and appear as yellow grayish lesions with a clearly defined red margin. So if we can see that the margins are clearly defined, and we can make it very clearly where the margins are standing and where the margins are ending. Now come the major aphthous ulcer. These are less common and can extend into 1 centimeter in diameter. These are not very often observed in clinical settings. You cannot see so often as compared to the minor aphthous ulcer. They take months and months to heal. I mean, I remember a couple of patients where the healing time takes place 2 months. So imagine a situation for 2 months, you cannot eat a regular food because of the spice level, because of the irritation, because of the pain, because of the chronic kind of anxiety you have to go. So it's very important to make these ulcers heal as early as possible, not only to avoid complications and secondary infections as we discussed, but in order to ease and make the quality of life much better. And they may heal with scarring. So that's another factor. And they have crater-like appearance. If you can see in this diagram, it's well defined how the major aphthous look like. Third one is herpetic form ulcers. Herpetic form ulcers, they are basically mostly seen in the tongue area, and they are small, but they are in groups and small clusters. And these clusters sometimes coalesce towards each other and form a big scar or a big ulcer. But most often you can see that they are seen in minute dots, and these ulcers are separated but are in very close proximity to each other, and they usually take 1 to 2 weeks to heal. Now let's understand the pathophysiology, how the aphthous ulcers occurs and what actually happens and what are the key important mechanism involved inside the body. So recurrent aphthous stomatitis pathogenesis involve a cell-mediated immune response in the oral mucosa, and cytokines plays a very major role, inflammatory cytokines. Studies detected and characterized that T helper cells screening type 1, and in type 1 that includes pro-inflammatory cytokines interleukin 2, interleukin 12, tumor necrosis factor gamma, and so on. And also the T helper cells type 2 that includes interleukin 4 to interleukin 5, 6, and interleukin 10. So these pro-inflammatory cytokines play a big role in pathophysiology of the aphthous ulcer, and these findings suggest that there is an increase in type 1 cytokines levels, as we mentioned, interleukin 2, interleukin 12, and tumor necrosis factor alpha may influence the immune response against reactive recurrent aphthous stomatitis. Now, genetics also play a very strong role in recurrence or an occurrence of aphthous ulcers. As we discussed initially, genetics and immunology play significant roles in development of aphthous ulcers. A genetic disposition, particularly linked to specific human leukocyte agents such as human leukocyte agents B12 and human leukocyte agent B51, it increases the susceptibility of the aphthous ulcers. So also, aphthous ulcers are associated with autoimmune responses, where the body immune system mistakenly attacks healthy oral mucosa, leading to ulcer formation. This interplay between genetic markers and autoimmunity highlights the importance of both factors in recurrence of aphthous ulcers. So definitely genetics play a very big role in aphthous ulcers. Now, microbiological aspects of aphthous ulcers. Changes in bacterial flora uh, is very much influence how the aphthous ulcers will occur, how they will heal, and whether you will have a secondary infection, the patient will have the secondary infection or not. Especially colonization of Streptococcus mutans and Helicobacter pylori. These two organisms are very well linked to severe ulceration. Some viruses, such as Epstein-Barr virus or cytomegalovirus, also play an important role in triggering the ulceration into more severe form. The clinical point here to note is that we have to avoid those oral care products that disturb the oral microbiome. We have not to look into more towards the alcohol based oral care products because they will kill both the good bacteria and the bad bacteria, and we don't want that. We want the growth of good bacteria to populate so that it can suppress the growth of pathogenic bacteria, and that's why it is very important to understand the microbiology of oral microbiome and how we can apply it through a neutral and gentle oral care products. Now, role of nutritional deficiencies. Nutrition also play a very big role how the aphthous ulcer is going to heal and whether how much the occurrence and reoccurrence will happen, especially vitamin B12 and iron deficiencies. These two nutrients play a very big role in aphthous ulcers. Studies state that iron deficiency is more common than vitamin B12 and folic acids in patients with recurrent aphthous stomatitis. Iron deficiency particularly causes a decreased capacity of the blood to transport oxygen to the oral mucosa, resulting in epithelial atrophy. And this condition is highly susceptible in developing the recurrent aphthous stomatitis. That's very important, and that's why it's very important to understand the nutritional status of the patient. Zinc deficiency is also associated with impaired healing and increased ulcer recurrence. So, the clinical point here to understand is that we have to use nutrients as a source to support the oral mucosal integrity and to build up that immunity, both systematically and also locally. So we have to look for the options how we can take care of oral cavity in grasping those nutrients even at the local level inside the oral cavity, how we can supplement the oral cavity with more nutrients, with more minerals, with more micronutrients, enzymes, which are essential for our oral mucosa to maintain strength and to take that micronutrients in order to work better. This is also very important. There's fluctuation of hormones, especially with the females. During the menstrual cycle, many women report increased ulceration occurs, potentially linked to the fluctuation of estrogen and progesterone hormones. Ulcer frequently decreases during pregnancy due to elevated hormone levels. And why this is so? There's a reason for that. Low level of progesterone and normal level of estrogen represents an hormonal imbalance. So low level of progesterone, but normal level of estrogen represents a hormonal imbalance that can result in decreased function of anti-inflammation and chemotaxis, triggering the onset of recurrent aphthous stomatitis. This mechanism also explains why recurrent aphthous stomatitis does not occur during pregnancy. That increases the level of estrogen and progesterone because both the levels get increased. Progesterone is potentially immunosuppressive. So therefore, it is assumed that the decreased level of progesterone will reduce the anti-inflammatory function, and consequently, the oral mucosa becomes vulnerable and an inflammation that can lead to recurrent aphthous stomatitis can occur. So it's important to understand the balancing of these hormones. Another clinical point here to note is that we should recommend and use those kind of oral care products that are safe in pregnancy, and a woman can use it, supplementing them with good nutrients. Linkage to systemic disease. Uh, Definitely, the most prominent medical disorder associated with recurrent aphthous stomatitis is Behçet's syndrome, characterized by recurring oral and genital ulcers and sometimes eye lesions. Although Behçet syndrome usually affects adults, a number of cases has been reported in children. Uh, Other than Behçet disease, there are other conditions which can enhance the chances of getting aphthous ulcers, such as celiac diseases, when you have inflammatory bowel diseases, ulcerative colitis, Crohn's disease, and so on. And whenever your immunity get compromised in situations such as HIV and AIDS, you have higher chances of getting aphthous ulcers. So the clinical point here is to note that you should rely on the oral care products that are safe, and safe in terms of oral cavity and safe in terms of systemically if by accidentally ingested, and they are also be safe for diabetic point of view. Now, what is the influence of psychological stress? So stress hormones, elevated cortisol's level can impair immune functions, and definitely it can contribute to the mucosal vulnerability. Lifestyle interventions, stress reductions definitely can help in lower the aphthous ulcers accretion and so on. Patient counselings also play a big role. So another, when you have an alcohol-based oral care products, it can lead to burning sensation, triggering in the oral cavity, which is not good because then, as we mentioned earlier, it will increase the anxiety level, it will increase the stress level, and hence there is a chances of recurrence of aphthous ulcer. So it is recommended that oral products that doesn't cause any burning sensation and are very gentle to your oral cavity. Clinical diagnosis. So diagnosis of aphthous ulcer is primarily clinically based and based on the characteristic feature of the lesion and the patient history. A detailed oral examination is the key to differentiate aphthous ulcers from other conditions such as herpetic lesions, traumatic lesions, or even in case of cancer, we can say oral mucositis. So it's very important to clinically make them very clear whether they have a well-defined red margin or not, they have centralized pus or not, so the different ways. However, we can rule out the other conditions such as malignancies by doing biopsies. History play a very major role. So it's thorough history taking is a key. We have certain diagnostic tools as well, which we can use. such as we can check the nutritional status of nutrition, whether vitamin B12 and iron deficiency is not. We can, as I mentioned, we can take biopsy. Certain immunological tests are also there which can rule out the autoimmune conditions such as Becher disease in severe cases. So we have a lot of strong ways if we are confused clinically in diagnosis the Aphthous ulcers. Now, early diagnosis is very crucial. Why it is very crucial, early diagnosis? Because it will reduce the healing time. Definitely, we can give the care in a very early phase so that patient has not to suffer so long. So we better we diagnose early, the better we can give the care early. They will have a better pain management, right? So the patient has not to suffer with pain for prolonged duration, especially if you have major aphthous ulcer that takes months and months to heal. Prevention of recurrence. I mean, when we do early intervention, we can change the lifestyles, we can do the diet modification, we can give the patient with the right oral care products in order to avoid the recurrence of aphthous ulcers. So these things play a big and a major role. Now, treatment option for aphthous ulcers. The primary goal for management in aphthous ulcer, the main goal is to relief of pain, reduction of ulceration, and acceleration of healing. So basically, we have to achieve only these three goals: to reduce pain, to reduce ulceration, and how we can enhance the healing process. And the secondary goal is to prevent recurrence and to prevent any kind of secondary infections. So we have primary goal and the secondary goal. Topical steroids plays a major role sometimes in managing the inflammation and accelerate healing, but it has some side effects as well. So we don't recommend to be as a first line of treatment. Pain management can be done by topical anesthetics, example lidocaines, or if you have a lidocaine spray along with certain minerals and nutrients, it will be a very plus and additional benefits. Oral rinses, that's the key. The type of rinse which we are using on a daily basis, 3 times a day, 2 times a day, does that rinse contains any micronutrients? Does that rinse contains any alcohol, which is drying the oral mucosa and making the condition more worse? So we have to look on the multiple factors, and in that factor, the point of care in the home, oral rinse and the oral care products plays a very big role. So the research mentioned that I'm just pulling up a very great study, treatment strategies for recurrent oral aphthous ulcers. In this study, they recommend corticosteroids, but there's a cost to that. And there's a cost of a lot of side effects related to systemic toxicity. So typically, corticosteroid should be our second or third line of choice. Pain management, as we mentioned, we can manage through rinses or some benzocaine gels. Non-steroid anti-inflammatory drugs can also be prescribed, such as ibuprofen, and it all depends upon the clinical situation. There is a no hard and fast rule. There is a no set criteria that we have to follow, like step one, step two, step three. We have to manage pain. We have to manage the ulceration. We have to manage the enhance the healing process, but it all depends upon the clinical situation of the patient at that particular time. We can also rely on the alternative therapies such as honey, coconut oil, sea salt that can play a very big role in managing the the clinical picture of aphthous ulcers. And again, the key is right oral care product, because even once you have an ulcer, how you are going to manage your oral hygiene. So the right oral care product plays a very big role. It supports oral hygiene, because if you have a multiple ulcers in your mouth, how you are going to do an alcohol-based mouth rinse that can further create a burning sensation? You cannot brush it. with toothpaste that contains sodium lauryl sulfate, it will worsen the situation. Balancing of the oral microbiome. I mean, the oral care products that we are going to use is helps in populating the good bacteria so that they can suppress the growth of pathogenic bacteria. And if we are using harsh chemicals, they will kill both the good bacteria and the bad bacteria that make the situation very worse. The oral care products should promote healing so that the recovery is faster. And most importantly, the oral care product that we are recommending to the patient should not cause any side effects. Now, it is very important to understand, and I am again stressing on this, that there are millions of bacteria that are present in the oral cavity in general, and it is very important to maintain the balance. A balanced oral cavity protect you, the patient, against infections and inflammation, and its disruption, if you have more pathogenic bacteria, can lead to harmful bacteria thriving and increasing the risk of Aphthous ulcers. So maintaining a very balanced microbiome is very important, and that cannot be achieved until unless we are using natural oral care products that not only supplement the nutrition but also does not have any side effects, so that the good bacteria not get affected. Now the question is that why are regular oral care products not the best choice? Because they cause more harm than benefits. Why? They contain chemicals, they contain colors, they contain alcohol, they contain artificial flavors, fluoride, harsh preservative, sodium lauryl sulfate in the toothpaste, parabens. All these will make the situation more worsen, increase the pain, and make it very difficult for a patient to heal in a shorter period of time. So if we look upon the recent research publications, they mentioned that alcohol-based mouth rinses, for example, chlorhexidine, in this article mentioned that it disturbs the oral microbiome. So it disturb means when you flush oral alcohol inside the oral cavity, so it will kill not only kill the bad bacteria, but it will kill the good bacteria as well. So the whole microbiome balance is disturbed until unless you then again repopulate the good bacteria. But how you can do that if you are continuously using the chemical and alcohol based mouthwash? The notable side effects for these products are mucosal irritation. The mucosa becomes highly irritated with alcohol. You want the tissues to settle down, to calm down, to rest the cells so that they can grow and increase the healing process rather than to avoid any irritation. But these products irritate the oral mucosa. That's why the healing gets delayed. The drying effect. Alcohol also removes the moisture from the mucosal surface, which is essential for healing. You want a moist, nutrient environment for an enhanced healing process. So drying the tissue will delay the healing. And so alcohol-based products are very bad when we're looking for the healing process of the ulceration. Disruption of microbiome. I mean, alcohol-based products can disturb extremely the microbiome of the oral cavity as we discussed initially, and it is no good for the healing process. Studies have shown that delayed wound healing is one of the leading cause of the post-operative infection. So by using all these alcohol-based products, we are delaying the healing process and we are increasing the chances of secondary infections as we discussed initially. So definitely, when you have a delayed healing, there is a higher chances of bacterial colonization, Staphylococcus, Streptococcus, as we discussed initially, and there are more chances of getting into systemic infection involved. So what is the solution? If you don't use regular oral care products, what is the solution? So recently, with lot of inventions and lot of attention has been gained to or natural oral care products. And what kind of natural oral care products? Sea salt. Sea salt turns out to be very effective in managing the aphthous ulcers. Why? because sea salt based solutions are free from any colors, alcohols, chemicals, fluoride, sugar, and preservative. It's an hundreds of years formula which our grandma is using from generation to generation, from century to century. When you have any infection, when you have any inflammation, warm some salt water rinse. We are doing it for centuries ago. It promotes healing. The natural minerals found in the sea salt supports tissue regeneration and wound healing, making it an effective choice. And most importantly, it has a lot of minerals. And these minerals, like sodium, potassium, calcium, this plays a very big role in biological processes and natural repair mechanism and regeneration of the tissue. This is a recent study that has been published that highlighted the importance of sea salt based mouthwash in managing the xerostomia. Very great study. Sea salt works best. How? It reduces the inflammation and swelling. But obvious because sea salt is an hypertonic nature of sea salt helps to draw the excess fluid from the inflamed tissue and thus reduce swelling and balance the microenvironment inside the ulcers and helps to manage the heal fast. pH is balanced. There is no acidic chemicals and alcohols involved, so they will not drop out the pH to such a drastic level that the good bacteria also got killed. So it's important to maintain a good pH in order for a better healing. Antimicrobial action. So sea salt is a natural antimicrobial in nature. How? Elements, for example, sodium chloride present in the sea salt helps dehydrate the cell wall of the harmful bacteria and inhibit their growth. Magnesium, another important element, it possesses anti-inflammatory and antibacterial properties, promoting skin and mucosal healing. Calcium, calcium is another element that supports the barrier function of the cells and play a major role in bacterial defense. Potassium also aids in balancing the moisture in the tissue, which helps control bacterial growth. Zinc, it's a natural antibacterial and it has an amazing wound healing properties. So all these elements, micronutrients present in the sea salt makes a huge difference in the healing process. There's a lot of media attention also how the sea salt is giving a great results in healing. These are the different sources, what to know about gargling and all these medical news today, headline today, all are covering nowadays with a great attention to the sea salt based oral care products and even the sea salt in general. Lot of studies that shows that how it improves the healing process and oral hygiene in diabetic patients after oral surgery. So we have a lot of data that supports the context behind the sea salt efficacy. It supports natural healing. It creates a balanced oral microbiome. So the studies have confirmed that patients using sea salt rinse have fewer infections, complications when we deal with the post-operative infections. Rinsing with sea salt enhance the growth of the fibroblast. So if the fibroblast is enhanced, that means our tissues are responding fast and definitely it will increase the healing. Lot of scientific data, lot of research. There are numerous papers that support sea salt as an effective measure for oral hygiene and healing process enhancement. Sea salt based mouthwash helps in improving oral hygiene among young population, and young population are the targets for the Aphthous ulcer. So if they use sea salt based oral care products, they are going to be much more benefited. Now it is also important to understand which salt is the best. All salts are not equal. Which salt has a higher mineral content that can works best? How the salt is harvested? How the salt is processed? What is the purity level of the salt? It is very important to understand so that we can choose the right amount and the right type of sea salt for the best results. So sea salt from Red Sea is the best sea salt you can ever get in the oral care product. It contains 82 plus minerals. These minerals you will never find in any other salt present in planet Earth. I mean, this is the most saturated mineral packed sea salt you can find available that can immensely benefit not only the healing process but supplementing the oral tissue with the micronutrients and elements of the nature. Please note that table salt is not sea salt. So if we are rinsing with sea salt, table salt based, home based table salt, it will not give the results which we are looking for in order to manage the Aphthous ulcers. Why? Because the table salt is only two minerals, sodium and chloride, as compared to the sea salt that has 80 plus minerals. Sea salt from Red Sea is evaporated and sun dried. Table salt is processed in chemicals, in factories. They have commercial production. It is always Red Sea salt is hand harvested, pure form. But the table salt is processed and chemically refined. And the sea salt, because it is procured from the ocean, and ocean contains minerals and elements that perfectly align with the human body, and that's why there is no comparison between sea salt and the table salt. So there's a different ways where we can prevent reoccurrence of the Aphthous ulcers by avoiding triggering factors, by diet modifications, lifestyle modifications, and using natural oral care products such as sea salt-based oral care products. And that can make a huge difference in the life of an patient dealing with Aphthous ulcers. So how you can integrate those steps? Number one is education, providing the patient the right education, how to avoid those things that are triggering the Aphthous ulcers, recommending natural products, routine screening when they're coming for regular cleaning, like how they are doing it, what is the level of them, and collaborative work. It's a collaborative work. You have to combine a team with dental hygienist, dentist, as well as the dental assistant all together in order to implement those strategies to have a 100% positive result. Best practices, patient history, and again, avoid the alcohol, sodium lauryl sulfate based everything that contains chemicals. It will slow the process, and it is very important to take care of these things. Another options are nowadays new treatments are also considering biologics where we can say that where we can deal with the pro-inflammatory cytokines. Low laser level therapy is also playing a big role, but it is not so often available in every dental setup. Probiotic also works best in managing the Aphthous ulcer, but the problem with all these three above mentioned treatment modality is that if again we are using alcohol based mouthwash and the chemical based oral care products, so all these three upper mentioned treatment modalities will not work. So it is very important to keep our oral cavity gentle, moist, and nutrient rich, and that's why it is important to choose right oral care product. These are some of the references. Even the cancer patients are recommended to use salt rinse as part of their healing process. Recommendations by National Cancer Institute, by Cleveland Clinic, MD Anderson's, and so on. So all the big hospitals are recommending sea salt rinse as part of the treatment options in managing the side effects. And hence, while adopting all these strategies, definitely we will have a value-based practice. We have less follow-up, improve patient satisfaction, and definitely recommending the natural oral care products helps in managing the balanced oral care and the balanced oral care mucosa. So the key takeaways are recognize clinical features and differentiate Aphthous ulcers from other oral lesions, address any underlying nutritional deficiency and systemic conditions, avoid alcohol and chemical based oral care products, and recommend natural oral care products such as sea salt based mouthwash and natural oral care products that can help in repopulating the oral cavity with the right amount of good bacteria, micronutrients, enzymes, that helps in maintaining the integrity of the oral mucosal membrane. And altogether, it will strengthen the oral mucosa and prevent it from recurrence of aphthous ulcer. By this, because of the time constraints, I have to little bit wind up in the fast in the later phase. So I am very much open to question and answers. Everyone is very much welcome to reach out to me by through LinkedIn or through my email ID if we don't find time to answer all of your queries. So please feel free to reach out to me. Thank you very much.
Thank you, Dr. Saini. Excellent presentation.
Thank you.
You have many questions here. I'm going to try to pull out the ones that are not overlapping here. And again, if we don't get to all of them, please reach out to Dr. Saini and he will definitely get back to you. What is the difference between aphthous ulcers and herpangina?
So there's a critical difference between both of them. Aphthous ulcers, when you have a patient of aphthous ulcer, there's a throbbing pain, which you can be distinction between that one of the symptom that can patient tells. Secondly, clinically, when we examine that, we have a well-defined red margins with a centralized pus that makes a differentiating point from the second lesions.
Okay. If an ulcer is swabbed and checked for bacterial growth, will anything develop? What bacteria?
Not so much. We cannot detect it through bacterial, but it's a secondary infection. So we cannot rely on bacterial, cell culture or microbiological culture to diagnose aphthous ulcers. No.
How do you feel about laser treatment? I know you mentioned a little bit about LLT.
Yes, low-level laser therapy plays a big role because they, make the circulation of the blood in the localized region as well as helps in growth of the cells that in a way directly, triggers the fibroblast, gingival fibroblast to enhance the growth. But as I mentioned, there are limitations. Every dental clinic and every dental setup doesn't have low laser therapy, and it also depends upon the different frequencies of the laser levels. So, but yes, there are situations where low laser therapy plays a good role.
And would you recommend, if you're using LLT, to also use the sea salt oral rinse with it at the same time, correct?
Yes, 100%, because at the end of the day, by going home, we have to take care of the oral cavity by ourselves, and we don't want to flush alcohol, chemicals, and all the bad stuff into our mouth. We want to keep our oral cavity gentle. We want to supplement it with nutrients, elements, and enzymes that are compatible to the human body and the oral mucosa in general. And that's why we recommend natural oral care products.
Thank you. I know you mentioned steroids. What is your feeling about magic mouthwash?
Magic mouthwash is very often used even in oral mucositis, but the problem with the magic mouthwash are two problems. Number one, these are very costly, and secondly, these are not covered by the insurance anyhow, and it is a prescription. So if you are having an ulcer, definite, then it's a mess for a patient. First, they have to take an appointment with the doctor, then they have to get a prescription, and then they have to wait for the magic mouthwash to be delivered to them. So it's a process. It will take a couple of weeks. Sometimes it takes 10 days, depending upon how much proximity with yourself with the compound pharmacies. So that's why it is very important to rely on those sources which are very handy, such as sea salt based oral care products that can give you equivalent and more benefits as compared to a magic mouthwash. And there are studies that have been published. I can email those studies, anyone interested in knowing more about that, that shows that sea salt based mouthwash has an equivalent effect as compared to the magic mouthwash. And I think I have mentioned that study in my presentation as well. But because of the time constraints, I cannot go into much deep into each and every study, but I am more than happy to send those papers to anyone interested in learning more about it.
Thank you. Can those with hypertension use sea salts?
Yes, because we are using superficial. We are not ingesting the mouthwash. We never ingest any alcohol-based mouthwash. So we are just rinsing it and spitting it out altogether. And also, if accidentally we swallow also, it is safe. because it has micronutrients and all the lysozyme and enzyme. But altogether, we say that we are not going to use it internally. We are just rinsing and spitting it out. So there is nothing related to hypertension of sea salt.
How do you,
Rinse.
I'm sorry. How
Yeah.
do you feel about dexamethasone?
Uh, I'm not a big fan of that. So I will not recommend that
Okay.
because
All right.
it has a lot of side effect as well. And
How
the
do
and the
you,
major and the
I'm
sorry
sorry.
to interrupt you, and the majority of the side effect and the main side effect is that it disturbs the sleeping. So the patient will not able to sleep well, and
Mhm.
in a way, then again it will relate to anxiety, and anxiety will relate to the Aphthous ulcer. So it's a vicious cycle.
What about irrigation with ozonated water?
Uh, Oxygenated water is a nice way to flush and rinse your mouth, but it doesn't contain any nutrients. It doesn't contain any elements of the nature as compared to the sea salt from the Red Sea that has 82 minerals and elements. So ozonated water doesn't contain any minerals. So it is very important to understand the role of micronutrients in order to make our oral mucosa strength and give that boost of immunity.
Thank you.
Yes, ma'am.
After SRP or dental treatment, should this be recommended? If so, where can it be purchased?
Well, we have a corporate presentation after my Q&A discussion. So there's a couple of ways where you can buy this sea salt based oral care product. And as far as my knowledge is concerned, there is only one company, H2 Ocean, that holds the patents for the same, and that can only provide you with the most authentic, original sea salt based products, which you cannot get from anywhere. So definitely, I will say hang out till last, and you will able to learn more about these products and how you can get them and how you can make the life of the patient much better by incorporating those oral care products.
And at the top of the screen, we just posted the link to the products. We're going to have a presentation here by Eddie Kolos, who is the CEO of H2 Ocean. So if you'd like to stay on for a few minutes, we're going to put the code up on the screen for you right now, the passcode. And we can address a couple more questions, Dr. Saini, too. 953857 is the code for the quiz. You'll find the link to that quiz in your handout. Is Celtic salt good as well?
I mean that's a good, but it's the way like you are comparing a car moving at 70 miles per hour as compared to a car driving at 130 miles per hour with total safety. So which one you want to choose? You want to fly in or you want to go by a car? So when you have a very safe, high quality, effective, zero side effects solution, why we want to look for those options which can lowers the quality and makes the healing process slower. So always go for the best and the original oral care products based on sea salt. As far as my knowledge, as I mentioned, because the company only holds the patent, so there is no point you can get better than those.
Great. And we'll go ahead and take one more question and then bring up Mr. Kolos. We have someone who makes a comment. I've suffered from these all my life in my 20s and 30s, getting 3+ new sores every week. Tried everything out there, only found temporary relief with all treatments. SLS free toothpaste was one.
Yes. So the reason for that is that because every time you're using the same mouthwash, alcohol-based, chemical, and everything you're putting into the mouth twice or thrice in a day, so you're flushing out the good bacteria. The good bacteria doesn't sustain in your mouth, and again you get irritation from these chemicals, and you have allergic reactions that are causing those Aphthous ulcers. So definitely I will highly recommend to give a strong try to this sea salt based oral care products, and definitely you will see the difference in the life and the quality of yourself.
There's some questions I think that would be better answered, Dr. Saini, after Eddie's video, especially
Okay.
around pH and that sort of thing. Let's go ahead and play the video for those here. Again, stay on to learn how to obtain the products by H2 Ocean. This is Mr. Eddie Colos. He is the CEO of the company and the founder and the creator. I'm going to go ahead, and then he's going to be available to answer your questions. At the top of the screen, tap on that blue banner and you'll be able to access the information as well and submit your request.
Use of sea salt based products. Hi, I'm Eddie Colos, the CEO and inventor of the first ever sea salt healthcare products. Today, I'm excited to introduce to you H2 Ocean, a global leader of sea salt healthcare products since 2001, pioneering the use of sea salt based products in healthcare. Over the years, we have developed more than 32 products across various categories, distributed both in the US and internationally. Our commitment to excellence has earned us awards for Entrepreneur of the Year and globally recognized. We are not just about business, but we're also deeply committed to ocean conservation. At the heart of every H2 Ocean product is sea salt from the Red Sea, known as the world's most mineral-rich sea salt. This hand-harvested, unrefined sea salt contains over 82 trace minerals naturally aligned with the human saline system. This unique composition is what sets us apart from all the other products. We uphold the highest standard in quality in our production. Our products are patented, cruelty-free, and manufactured in an FDA-registered facility. We are committed to continuous innovation and development, ensuring that we stay at the forefront of sea salt healthcare. Now, let's focus on one of our flagship products here, the H2 Ocean Healing Rinse, the world's first sea salt-based mouthwash. What makes this so special? The key ingredients: red sea salt, enriched with 82 trace minerals, hand-harvested, unrefined, and perfectly matching the human body saline system. Lysozyme, an antibacterial enzyme that enhances immune system's protective function. Xylitol, a natural sweetener, approved by the FDA and widely accepted in the dental industry for its oral health benefits. Our sea salt mouthwash offers excellent results in various oral health issues, including dry mouth, bad breath, post-extraction care, implant hygiene, and daily oral care. It is safe for all ages, including diabetics, and contains no alcohols or dyes, or any harsh preservatives like fluoride or added sugars. It's scientifically backing. H2 Ocean's mouthwash isn't just a product, it's a scientifically proven solution. We conducted extensive studies on its effectiveness in treating gingivitis, dry mouth, dental caries, and for orthodontic hygiene. These studies have been published in reputable scientific journals. H2 Ocean has become the #1 post-dental care mouthwash for surgery, orthodontics, and implants. We offer excellent patient compliance with our cleaning with healing approach. Our product comes in 2 natural flavors, the Arctic Ocean Mint and the Lemon Ice, in 3 different sizes to suit your various needs: the 64 ounce, the 16 ounce, and the 8 ounce. For dental professionals partnering with H2 Ocean, we offer both clinical success and financial growth. We have 2 main partnership programs. A wholesale partnership. This program offers significant discounts, allowing partners to generate additional revenue. For example, our 8-ounce mouthwash bottles, we have a manufactured suggested retail price of $10, but they are available for our partners for just $5, offering a 50% profit margin. The affiliate program. This is a flexible, zero commitment program that allows partners to earn without any overhead costs or inventory hassles. It's a simple 4-step process to get started, and partners can potentially earn a minimum additional income of $13,000 annually based on referring 100 new patients each month. H2 Ocean is more than just a product. It's a revolution in oral care. Our sea salt-based mouthwash offers unparalleled benefits backed by scientific research and trusted by customers and industry partners alike. We invite you to explore partnership opportunities with H2 Ocean. Whether you're interested in the wholesale program or an affiliate program, we're here to support your success. Thank you for your time today. If you have any questions, please don't hesitate to contact us at info@h2ocean.com or call us at 772-219-8183. Together we can transform oral health care with the powers of sea salt. Thank you and enjoy.
All right. Thank you so much for being here, Eddie, and thank you to H2 Ocean for your support this evening of Dr. Saini's presentation. We have some questions for you.
Sure.
Questions about the type of salt. What's your opinion on Himalayan salt and pH?
Well, Himalayan salt is mined out of the Himalayan mountains, and one side is Indian based, the other side is China based. So they're using heavy machinery to extract the salt from the mountain. And with that, it will have high amounts of iron and also lead, and, could be contaminated. So even though your body might not be able to process that, it's not what I would recommend as a favored salt. And it's definitely not sea salt. And what was the other question? Was it about
pH involved? Mm-hmm.
So the pH changes even from cold to hot. As a scientist or a lab naturalist, chemist, you're going to know that pH will not change the body's pH when you're just using it in a short term. pH is mostly very important for the bloodstream, not necessarily for your skin or for your eyes and for your mouth and cavities like that. I mean, you're taking in different types of food or coffees or drinks that have an acidic pH, and it's proven that your body will go back to its normal pH. Our mouthwash will actually try to balance the pH more naturally where you need to be for a healthy pH in your body.
Has there been any studies other than observational studies to put the types of salt, table red, etc., head to head against a placebo to determine the effectiveness?
So in our studies, yes, we would have double blinds, and mainly on the diabetic wound research that we had. It was put on with Dr. Lee Rogers and also published in the journal called Wounds. Well, that showed we had 2 different placebo case studies on that for the comparison of our sea salt to those placebos. And of course, the outcome was much more favorable with the mineral content. With other salts, when I wrote the book on the science of sea salt, we have done pretty much extensive salt research around the whole oceans of the earth to find out what the best sources. There is many other ones that are also favorable, but we feel like the Red Sea is the most organic and the best sea salt that you could find. It's surrounded by the desert. It's not polluted, and it's also extracted with an unrefined process.
What about the flavors for children?
So flavors for children, it's not going to harm them. These are natural flavors that we put into our mouthwashes. If that's the concern, we don't use any dyes. And it's just a dependence on what type of flavors that you're going to accept. Not supposed to make it like a drink anyways, but it's supposed to help clean, feel refreshed, and flavorful, because some people don't even like really salt taste in their mouth, at least if it's too salty. We do not put in extra salt, so it's not like a hypertension salt or a hypo site.
And also to add to Eddie's comment, the mouth rinse also contains xylitol, which is a natural sweetener from vegetable and plants. So that will also help in making it very pleasantable and very gentle and good to rinse.
Yeah, kind of like a Pedialyte or a Gatorade. They're using also sugars to balance out the salt, but I think xylitol is much safer way. It's a diabetic safe way to balance that sweet and salt.
So another question about the studies. When was the wound issue put out? Can they reach out to you and get that information from you?
Yeah, that was an early study. I don't remember how long ago, but it must have been somewhere around 13 years ago. But if they even just Google sea salt based wound sprays, that should come up. I think it was also reposted by WebMD. And so it should be out there. And that company is called OceanAid, which is our company too as well.
Can you apply an ozone generator to your rinse as a potential?
Yes. Ozone is made actually by using a saltwater solution first, and then going through the ion system, which will put electric charge on it, will cause ozonization of the water and hold in the solution. So yes, we've looked at that too as well,
And to that note, I want to add to Eddie's note, like ozone generator is been used in dentistry for a long time. If you Google even ozone therapy in dentistry, I believe my article pops out to the #1 article in the field of dentistry related to ozone therapy. And yes, in ozone generators, we can put sea salt, H2 ocean sea salt based mouthwash that will enhance its healing process and definitely prevent the need for irrigation in the root canal and so on. And definitely we are partnering with and we are discussing these kind of business models with other oral irrigators and different companies worldwide.
Yeah.
I do want to remind everyone to go to the top of the screen. If you tap on that banner, you can find out how to learn more about H2 Ocean and the products. And also in your course folder, there are a couple of flyers that they've included so that you can reach out and learn more as well. You should have all of those in your course folders. Does fluoride affect ulcers, Dr. Saini?
There are, fluoride is a matter of kind of a controversy. Some people like fluoride, some people hate fluoride. So I just want to adapt a neutral tone to this discussion without hurting anyone's sentiment. So it depends upon the situation. So everyday fluoride is not required in terms of oral care. So especially nowadays, even the government is saying that the water fluoridation of 0.7 is good enough, and even which is not required in the water, because now we are getting fluoride from fruits, vegetables, daily so many things we are getting fluoride. We are not required fluoride so much. And even if we are getting fluoridated water, why then you have to access more fluoride on top of that to enhance the chances of fluorosis? So fluoride-related toxicity and fluoride-related side effect has its own different discussion that can go for an hour and hour. But I will say that these fluorides sometimes cause allergic reactions, and especially it is not required for daily rinse as part of your oral care. We get enough fluoride from water, from the food, from the fruits, from the vegetables, so we are good with that. So we don't require that much of fluoride.
Thank you.
Yeah.
Question about hand, foot, and mouth disease. Is it an Aphthous ulcer? It's a herpes virus. I think it's a Coxsackie virus, but go ahead, doctor.
Yeah. Yeah, you're right. I mean,
Okay.
yeah.
Once they complete the form to learn more, Eddie, what can they expect? Are they going to get an email back from you, or how does that work?
Well, we'll have a customer service that will reach back out to you, either an email or a phone call. If there's a phone number there, we could send out the price sheet, the programs that we have with the affiliate program. It's very easy to find on our website, oralcare.h2ocean.com. Down at the bottom, there is an affiliate program button. You could fill out that form too as well if you just want to explore the affiliate program, which is very easy to do. We would have to approve you to make sure that you're a dentist or you have an office. But we do offer great service and discounts. If you sign up for our newsletter, we do not hassle you. We basically try to make sure that you get the samples, you try them. We appreciate the feedback. We've been around for quite a bit, so we've got nothing but great results from a lot of good reviews. And you can also find it on Amazon too if you want to research that.
Thank you. And this is an interesting question. Why is alcohol a driving factor for Aphthous ulcers but not salt?
Eddie, you want to go?
No, go ahead.
So there are two reasons for that. There are crystal clear reasons. Number one, alcohol, because it irritates the irritation. That's why you have burning sensation. It irritates the mucosa. And one. Number two, sea salt doesn't cause those kind of side effects. Secondly, alcohol is highly chemically processed, and it will help at the micro level. It initiates the necrosis of the cells and the cell walls, even for the healing cells. So it does not differentiate between a good bacterial cell or a bad bacterial cell. While the sea salt, it only contains minerals, enzymes, and nutrients. It is just filling the good nutrients in order to enhance the immunity. I used to give an analogy for better understanding. If you have a kid or if you have a child, do you want to feed him with junk food and you expect him to become a sports person, or you want to give him juice, nutrition, good healthy diet? So it's the same way for the oral cavity. How we are feeding our oral cavity. If we are feeding our oral cavity with the right enzymes, right nutrients, right minerals, our oral cavity will run faster at 100 miles per hour. If we are feeding it with carbohydrated drinks, sugary substances, creams, and pastries, then how that turns out to be. So it's as simple as it is.
Also,
Sure.
alcohol is a solvent that causes drying. Everyone knows that. So drying and pulling the minerals out of the body, which then the minerals are not being used properly. So we don't recommend that. So why would you put something bad in? Even if you add something good, it's not going to work the same way if you had everything that was good.
What about L-lysine?
Should I go?
Sure.
Yeah.
It's a peptide amino acid. You could take that orally. It would help. I believe so. They've recommended it also for the herpes symptoms, but it's not a cure. You're going to just enhance the mineral, which is going to help, viral infections and some ulcers too as well. So it could help. I do like it, but I don't think there's anything better than if you tried what we have put together, especially when it's a combination.
Question here, Listerine claims that regular use will lessen and or prevent ulcers. What do you think, either of you? Or both?
So I don't want to comment aggressively towards one company, but there are data, there is science. You can Google nowadays. I can give you the references if somebody wants to ask. There are chances where these alcohol-based mouthwashes, irrespective of the company name, they are causing cancer. So we are going in the opposite direction. So we are helping in cancer survivorship, and there is no strong data that can say that all the leading hospital and the oncology centers in the US, everybody mentions on their website to use salt rinse as part of managing the oral mucositis and the oral ulcer. And those mucositic lesions are much more harder to heal as compared to aphthous ulcer. So if the salt rinse can heal those kind of rigid ulcers that are compromising the quality of the life of the patient, so you can easily heal aphthous ulcers without any side effects with salt-based rinse. That's grandma's solution we are using for hundreds of years.
You can just Google pretty much every ingredient that Listerine has and just try to look up what each ingredient does for you. If it's safe, is it effective, is it a health product? You'll see the difference. You could do that with H2 Ocean too as well, and learn from your own research.
What about patients with GERD?
Can you repeat, please, ma'am?
Sure. How about patients with GERD, with gastric reflux disease? Gastroesophageal reflux disease.
So gastric reflux disease is also one of the reasons where people get, aphthous ulcer because of the aggravation of acidic nature inside the esophagus, and through that tract, it sometimes you feel more acidic, and it can have your throat ulcers and so on. Definitely, you want to rely on those oral care products that cannot enhance or aggravate those features, and also even if accidentally you swallow those rinse, it should be safe. It will not cause any harm. So that's why if you are based on the natural sea salt based mouth rinse, if you accidentally swallows it, it will heal those gastric ulceration as well rather than causing any side effect. Though we do not recommend anyone to swallow it every day, but if you swallow it, it is safe. And
Yeah,
Eddie has
I,
been doing it
I swallow it
throughout the
every
life.
day, and I swear it helps me with, I have colitis. My wife is in the hospital right now with diverticulitis, and I made her swallow some of it too as well to help her out. And instantly, it does do something to help your body. There is nothing in our products that are going to harm you, but we say that it's safe to swallow. We're not making a drink. We're not making a drug. We're not making a claim, but it is safe to swallow. And we feel like it does help that.
Do you do seminars on oral lichen planus?
We can.
We can. That's from the audience here. Dr. Saini, you had mentioned HLA and B51. What was the second one? I think it's in the handout. Do you recall?
It was HLA B12 and HLA B51.
Okay, thank you.
Yes, ma'am.
All right. Any other questions here? Did we address the question about using saline with a patient that has hypertension?
Yes, ma'am.
I think we did.
We
We
addressed
can't.
that. Yeah.
It shouldn't be a problem. Any other questions for us? All right. Anything you'd like to say in closing, Eddie or
Yeah.
Dr. Saini?
So I want to close it, then I will let Eddie to put his remarks as well. So I want to give a kind of an assurance from a clinical point of view that if you move toward the natural side, you will not repent. And it's always good to give a try. And we are almost 1000% confident that you are using these products, you will feel much better difference in the quality of life of yourself even before advocating the product to the patients. So it's a great way of enhancing the oral care and the quality of life in general.
Thank you.
Thank you.
Thank you, Dr. Saini.
Thank you also for having me and letting me explain a little bit about the company and doing this sponsorship. But I mean, I believe that there is a cure in the ocean for everything, and I will continue to make new products. Check out our website. We have other products. We use nothing but the top scientists and doctors that we reach out to do our scientific research and to do our education. I'm well informed. I've done marine biology work. I really am passionate about the ocean. And you could probably tell by looking at just some of the great things that we've done in our news feed, press releases that should be coming out more and more. And very exciting for this next year to show the world what we have that's been studied, but not released yet. So stay tuned.
Well, thank you both very much. And we want to thank H2 Ocean again for supporting these courses. Dr. Saini will be presenting other topics, and we do have a page. We'll be sharing that with all of you so you can sign up for the other courses that he'll be presenting. And if you have colleagues that would like to take this course, it'll be available live again throughout the year. And again, be sure to go to that banner at the top of the screen and make sure that you check out the other information that is also included in your course folder about H2 Ocean. Thank you both for being here this evening. And I really am excited about the next presentation. Bye now.
Yes.
Thank you.
Thank you so much. Thank you so much. Thank you so much for having us. And we will definitely keep on giving the new information and evidence-based information so that patients and dental professionals can take an informed decision.
Great. Thank you now. Good night.
Thank you.
Bye-bye. Good night. Bye.